Plan ahead for Medicare. Start early, stay informed. Retirement should be about enjoying life, not stressing over healthcare. Medicare is a big part of that picture. Don't wait until the last minute to figure it out. Starting early gives you time to learn about Medicare. You can make choices that fit your needs. Understanding your options brings peace of mind. Don't feel overwhelmed. We're here to break down Medicare in simple terms. We'll guide you every step of the way. Medicare has different parts. Let's start with Part A and Part B. Part A is your hospital insurance. It covers inpatient care, skilled nursing facility care, and some home health care. Most people get Part A automatically at age 65 if they or their spouse worked and paid Medicare taxes. Part B is your medical insurance. It helps pay for doctor services, outpatient care, medical supplies, and preventive services. You typically pay a monthly premium for Part B. Timing matters with Medicare. You have a 7-month initial enrollment period to sign up. This period starts 3 months before you turn 65, includes your birthday month, and continues for 3 months after. Missing this window can lead to penalties. Late enrollment in Part B can mean higher premiums. You don't want that. Part D, which covers prescription drugs, has its own enrollment rules and penalties too. We're here to make Medicare easy. Our services are completely free. We offer Medicare 101 seminars to explain everything in detail. You can find upcoming seminar dates and times on our website. Can't make it in person? No problem. We also offer webinars you can join from home. Remember, you're not alone in this journey. We're just a phone call away if you have questions. Let's navigate Medicare together.